Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, and welcome again to another episode of the podcast, The Wellness Optimizing Warrior MD, or the WOW MD. The topic of the podcast today is interesting because I thought I had so many women asking me these questions over and over again. I decided it's a good time to actually create a podcast and educate women about this. So the title is, Why Do Women Bleed Monthly? And why is your GYN recommending a birth control pill for hormonal imbalance? I did warn my listeners at the beginning in the first trailer episode that the purpose of the podcast was, other than educating whoever wants to listen, was pretty selfish. I personally keep repeating myself over and over again, saying the same thing so many times a day. I decided I want to create an online tool for my patients, and of course, anyone else could take advantage of this. Then I would refer my patients to this online tool, which is a learning, educational opportunity for them so they can better understand their bodies. And they're so educated that it's much easier to explain things. So in this podcast episode, I'm going to get right down to it. I would like to talk about the monthly period for a woman, what it means, how does it happen, and why do women bleed every month. If you're not a woman, you might want to skip this episode. But if you do have a woman or women in your life, this might simply be useful education, even though it does not impact you directly. So I'm going to get started by answering this question. Why does a woman bleed once a month? What exactly makes a woman bleed once a month? I always get this question around the timing of when to take progesterone. Because a woman takes progesterone as treatment that's recommended, they start bleeding at some point. So they blame the bleeding on progesterone. So I hear that a lot. Am I bleeding because I took the progesterone? Or I bled right after I took the progesterone? And then the next question sounds like, if I don't take the progesterone, can I avoid getting a period completely? So let's discuss what the mechanism for vaginal bleeding is. As a woman, you only bleed vaginally if you make or you are exposed to estrogen. We need estrogen first in order to bleed, progesterone second. I've used this analogy in a few of my previous podcast episodes, and I talked more in detail about why women bleed vaginally once a month when I discussed the estrogen and progesterone episodes. So you can go back for a more detailed review of how these two hormones work together. But let's recap here how these two hormones work to create a uterine lining and how the uterine lining sheds every month. I use this analogy, and it's my favorite analogy. Imagine the uterine lining is a brick wall. The estrogen creates the lining. Imagine the estrogen creates the bricks that make the wall grow tall. This happens for the first 2 weeks of your menstrual cycle. In the middle of your menstrual cycle, around day 14, naturally, if everything goes well, you would ovulate. At this point, your ovary will make progesterone to help support the uterine lining for the next 2 weeks, while your ovary continues to make estrogen in these last 2 weeks. Imagine, using the analogy of the brick wall, the progesterone is the mortar that gets applied onto the brick wall. It will also stop it from growing, solidify the wall, and hold it together. So for the first 2 weeks of your cycle, that's called the follicular phase, you only make estrogen. The estrogen creates the growth of the uterine lining until ovulation. And once ovulation happens, when the egg is being released by your ovary, then your ovary will continue to produce estrogen. And on top of the estrogen will also produce progesterone for the next 10, 12, or 14 days during the luteal phase of your cycle. Again, this progesterone hormone acts as a solidifier, stabilizer hormone that helps turn this grown uterine lining that has developed in the previous 2 weeks into a uterine lining that is amenable for implantation. It's called secretory endometrium. In the absence of the implanted egg, the ovarian production completely stops. The hormones disappear for just a few days until the brain realizes, oh, wait a minute, we don't have hormones anymore. It releases the FSH, LH hormones in a cyclic fashion, and it tells the ovary to start making hormones, and everything starts all over again. Now, when the hormone production drops to very low levels, it's a crash. It's like your hormones just crash. The uterine lining will do the same thing. It will crash, and that means it will shed. So imagine this brick wall completely crashing down to the ground. And here comes the bleeding. Here comes the flow. So using the brick wall analogy, the first 2 weeks, the estrogen helps create and build this wall. And then the next 2 weeks, the bricks are still there. The estrogen is still being produced while the progesterone is added on as a mortar to hold and solidify the wall together. Once both estrogen and progesterone go away, the brick wall will crumble. It will shed in the form of a vaginal bleeding, and the cycle repeats over and over again every month. This process repeats month after month as long as your ovaries are working. And again, they are making estrogen first, then you ovulate, and then you make progesterone for the next 2 weeks. When you no longer ovulate, or you cannot ovulate, there's a problem. You simply make estrogen a little more, a little less. The levels of estrogen, if you don't ovulate, can be quite erratic, up and down. So you build a wall, but there's no mortar to hold it together. And the wall can crumble even if you still continue to make estrogens because you put brick on top of brick on top of brick. So after 2 weeks, 3 weeks, 4 weeks, 6 weeks, or 12 weeks, depending on how long you go and how much estrogen you have, eventually the wall will crumble. And here's the confusion for a lot of women. They think because they have a monthly bleeding that they are, by definition, ovulating. That's not always the case. You can grow a wall in the same fashion without any progesterone, without any ovulation. As long as your estrogen production from the ovary, it's consistent and reliably the same every month, you will grow a wall and it will crumble repeatedly, persistently around the same time, giving you the false impression you're ovulating. So that might not be the case. So be aware of that. Now, when you make very little estrogen, but for a longer period of time, then the wall can grow undisturbed for a long time before it crumbles. So you can have a period every 3 to 4 months. You have very little estrogen, and the wall grows a little bit. And when it crumbles and it sheds, you get a period. It could be light and spotty. Or if you had some higher levels of estrogen, so you applied way more bricks to your wall, but consistently, persistently, you didn't dump a lot of bricks all at once. You just persistently created this wall. At the end of the 12 weeks or 10 weeks, you might actually flood and have a brick wall crumble in a very impressive manner. That's for patients or women who skip periods, and then when it comes, it floods. On the other hand, you can have that circumstance when you have a little bit of estrogen. A little bit of estrogen, your ovary produces something 2 to 3 weeks, very little, not a whole lot, and then it just stops. It runs out of steam. And then your wall will crumble again. So you could get these cycles that are every 21 days, 19 days. You can get a period every 14 to 16 days and you're completely puzzled, like, why am I bleeding this way? Usually it's because your estrogen produced some bricks, created a wall, a uterine lining, and then the estrogen stopped. Your ovary did not produce any more estrogen for whatever reason, and the brick wall crumbles. So hopefully this gives you a little bit of an insight and information to interpret by yourself what's happening in your body and what category of brick wall building you belong. So if you wonder as a woman why your periods are very erratic and hectic, especially at the extremes of our reproductive life, for example, in our teens and after our mid-40s, is because at these two extremes of our fertility, the body doesn't function properly and optimally for various reasons. For example, in our teens, when we're adolescents and we're immature from the point of fertility, the ovarian function, which is subject to the control exerted by the brain, it's not going to go without a hitch because the brain communication with the ovary, it's not mature enough. Your body needs to be very mature in a hormonal sense in order for your cycles to be ovulatory. Now, at the end of your reproductive life, when you're in perimenopause, the periods change because now we have something different. There's no longer this immaturity of the hypothalamo, pituitary, ovarian axis, which is the brain communication to the ovary. That's fine. That's been mature. You've had your children. Now what happens is the ovaries are running out of eggs. The problems with the period in perimenopause are due to poor egg quality. So many of the cycles will no longer have adequate progesterone, might not have progesterone at all, because there is no longer a good quality egg released from the ovary. So if there's a poor quality egg, there will be much less estrogen produced. Then the ovary is not able to make enough progesterone because it's a weak corpus luteum as well. And again, both of these circumstances, when we're very young or at the end towards perimenopause, fall under the category of estrogen dominance. And I talked ad nauseum about estrogen dominance and what does it mean? It means your estrogen progesterone balance is off. So please go back and revisit my episodes about the estrogen and the progesterone if you want more information about that. Let's stay on track. And now that I've explained how your periods are happening and why you bleed every month, let's talk about what happens when you go to the doctor and you tell your story about your periods being erratic or unpredictable or irregular, and why, unfortunately, the majority of doctors, whether they are OBGYNs, primary care, pediatrician, might just simply offer you the birth control pill or some other form of birth control that in their mind, and this is the information you're provided by them, is meant to regulate your periods. I personally believe that all physicians need to understand more and dig deeper into the mechanism of why women bleed irregularly rather than simply putting a Band-Aid on the situation. And the reason why I use the word Band-Aid is because getting prescribed a birth control pill or a birth control method to regulate your period, it's a Band-Aid. You have a zit, you cover it with a Band-Aid. The zit is still there, nothing changed. You just can't see it anymore because the Band-Aid is covering it. By taking a birth control pill to regulate your period and to address irregular periods, we do the same thing. We mask the actual condition. We make you have a regular period, but nothing gets fixed. So let me explain why birth control pill use for irregular periods is a Band-Aid. When you get prescribed a birth control method, that is a hormonal synthetic birth control method, this type of method will interfere with your periods, supposedly to regulate them, to make them more regular, more predictable by using this birth control method. And the top birth control method that is employed that way is the birth control pill. But doctors have also used the patch or the vaginal ring. Now, what happens when you use these birth control methods? Well, your body will receive these synthetic hormones from the outside because you introduce them into your body orally by taking the pill, or by applying the hormone to the skin through the patch, or by introducing the hormone into the vagina, and the body absorbs the hormone from the vaginal mucosa. Now, your brain gets the signal that there are hormones flooding your body from somewhere else. So, as a safety valve, and this is the way the body is built, your brain will simply stop your own production of natural hormones for both estrogen and progesterone. Once you start taking a birth control pill, a birth control patch, or birth control vaginal ring, you will no longer have a normal period, in the sense that the mechanism for a normal period will no longer apply to you when you use synthetic hormonal birth control pill or patch or ring. Again, the natural hormonal mechanism for having a period, I went all over it in the previous 5 to 10 minutes of the podcast. Please revisit it if you don't remember. But your body needs to make the estrogen naturally, followed by the estrogen and progesterone naturally after ovulation, and that's how you get a period. Now, coming back to using birth control pills or other methods to regulate your period, as long as you understand what is happening when you use these methods, that's okay. Unfortunately, I see women walking into my practice, all ages of life, that have been told and firmly believe that this birth control pill is regulating their periods. So in a very simple sense, a perception sense, your periods on the birth control method will be regular, in the sense they will come once a month. Your body stops producing any hormones on its own, so the bleeding you experience once a month from your uterus, it's simply because these hormones that you take daily or weekly or monthly create a uterine lining and create that brick wall effect. But your body is not doing that on its own. Using a birth control pill, it's not really treating your irregular periods. The birth control pill simply tells your brain, by introducing the hormones daily into the system, because you take a pill daily, it tells the brain the body has hormones and it doesn't need to produce anything naturally on its own. By taking a birth control pill, you're putting the ovarian production of your natural hormone, estrogen, progesterone, into a complete pause mode. The initial strategy and logic behind this approach, this is how I explain it to the patients when I employ this method as well. Once you put the body in this pause mode, so the communication between the brain and the ovary stops happening due to this outside artificial synthetic hormones, when this intervention, which we could use for 3 months, 6 months, or years, we hope as physicians, then when we stop this synthetic hormone use, you just stop taking the birth control pill. Again, we simply hope that your brain communication to your ovary will be established in a normal mode, just like when you reset a sophisticated computer that is no longer functioning or it's getting buggy. However, what's interesting to know, and what it took me years to understand, and additional education in the field of functional medicine, is that the human body doesn't need a reset like a computer. The human body needs to have the problem that is leading to the poor communication between the brain and the ovary, or the imbalance in the hormones. It needs that fixed. Just simply trying to use a birth control pill, putting things in a pause mode, and using this Band-Aid solution is not going to fix it unless we take other interventions to fix the problem. For example, we diagnose a woman with PCOS, and we treat the PCOS with addressing insulin resistance, changing her lifestyle. Meanwhile, we treat the excessive hair growth and the acne and the irregular periods with birth control pill, especially if she has the need for birth control. And we are working on the other side behind the scenes to fix the PCOS issue and what that's doing to her body. So when the birth control pill use is stopped, then the insulin resistance has been addressed, the lifestyle changes have taken effect, and now the ovary can work better because it's a better environment. So I really feel and believe that as physicians, we need to understand why a woman has irregular periods and actually treat the problem and not put a Band-Aid on it by telling someone, hey, here's a birth control pill, we'll fix it. That is my opinion, and I'll stand by it. I think many young women at the beginning of their reproductive life are being offered birth control pills when they don't really need them. And I think it's time for us physicians to stop using birth control pills, patch, ring, etc. as a treatment, especially when women do not need birth control. This is not really a treatment. It's simply a Band-Aid that will resolve nothing unless we address the cause. I believe this is even worse for a woman in her 40s or past mid-40s who is clearly going through perimenopause, because just simply shutting down her production of all the natural sex hormones, estradiol, progesterone, and testosterone, taking all these hormones away and using an artificial synthetic birth control pill will not provide any meaningful relief to any of her perimenopausal symptoms. Sure, it's going to regulate her periods. However, it will probably worsen her mood, her metabolic rate. It will affect her mental clarity. So at the end, we're going to end up with a very irritable, foggy, overweight woman who's not going to be happy with the treatment. Perimenopause is defined by a decline in estrogen with erratic, unsustained estrogen production, unpredictable and lower than normal or completely absent progesterone, and much lower to very low testosterone. This is what happens to your hormones during perimenopause. And as the estrogen production dwindles down to nothing, you approach menopause. Once there is no estrogen production for 1 year, then you are officially in menopause. Again, the menopause definition is when you have had no spontaneous natural bleeding for 12 months. At that point, you enter what's called postmenopause, which is the rest of your life after menopause. Now, I really hope that if you're a woman listening to this episode and you're in your 40s, even in your 30s, you need to be prepared because nobody tells you this. I hope this episode opens your eyes as far as what happens in your body with the hormones. And going to a doctor and using a birth control pill or a synthetic hormone to regulate your period, I hope you understand that this is not really regulating anything. It will simply shut down your natural hormonal production. You will have a fake synthetic period, which is real, feels real. It comes from your uterus, but it's not caused or induced by a natural hormonal production from your body. So let's go back to a natural cycle and the way it should be. So under ideal circumstances, you will see a doctor who will order some tests for your hormone levels and an ultrasound. Now, these tests might indicate you don't have enough progesterone, in which case your doctor should consider prescribing you progesterone as a support or as a replacement if you have zero. Now, this progesterone can act as the mortar/stabilizer of your brick wall/uterine lining. And again, those brick wall uterine lining are only there because your body made the estrogen. So you will bleed when you take progesterone, during or after taking progesterone, not because the progesterone causes the bleeding. Remember, without estrogen, there is no brick wall, there is no uterine lining, and there is no bleeding, no matter how regularly you will take your progesterone. When you find yourself in the situation of dealing with heavy periods, and your doctor might prescribe progesterone as a way of balancing your hormones and helping the quality and quantity of the menstrual flow of vaginal bleeding, please understand that it will take time for the progesterone to reverse the changes that are caused by too much estrogen and to improve your menstrual vaginal bleeding. It will not happen instantly, like you start taking progesterone and your period immediately gets better. It can happen in some cases, but in reality, it takes 3 to 6 months. Please know that balancing hormones especially the delicate balance between estrogen and progesterone, is crucial for a normal period. Our bodies do that naturally on its own in a perfect way. However, when the body is not healthy, this perfect cyclic functioning of our ovaries, creating the perfect environment and the perfect uterine lining to allow for pregnancy, will no longer happen. So again, our bodies need to be healthy and function well for this harmony to allow normal cycles. When your periods stop coming regularly, or the menstrual flow changes, or your periods become more painful, you should be aware that your hormones are no longer in harmony. They're not balanced right, and you should investigate what is happening with your body that is creating this problem. As doctors, especially as GYN doctors, we get very fixated that there must be something wrong with the ovaries or the pelvic organs if you have abnormal, irregular periods or very heavy menstrual flow or very heavy painful periods. And to a point that is partly true, because many times these heavy painful periods are due to having ovarian cysts or fibroids or a disease called adenomyosis, which is endometriosis of the uterus. But the real problem you should worry about is what caused this issue to start with. Why do we have this hormonal imbalance? Is your thyroid working well? And do you have enough thyroid hormones? Is your adrenal functioning well? Or do you have so much stress in your life that your adrenal gland is no longer functioning optimally, creating a dysfunction and an imbalance in your natural sex hormones? Is your metabolic process of elimination impaired by digestive problems, which is making it very hard for your body to eliminate and process the estrogen properly, leading to estrogen dominance? All of these issues will and should be addressed if your doctor would be preoccupied with finding out the root cause of the problem and have an interest in discovering and addressing it. However, that would require a functional medicine consultation, which takes time. And time is not always reimbursed at face value for the doctor. So very often, the doctor will choose the easy way out. And likely, they will do the best they know. And because they haven't been trained in functional medicine and how to go down and make an analysis and identify the root cause, it's easy and simple and quick to offer you a birth control method, the pill, the patch, the ring, to regulate your periods. Or more so, it could be offered as a treatment for your heavy periods. And it might even be used as a tool to stop them completely, which can bring you relief from your periods and can help locally by addressing the problem with your uterus, but it will bring you no relief from the root cause of the problem that led to your problematic periods. So remember, women bleed monthly during their reproductive life because they naturally make hormones that have to be balanced just right in order for them to have a monthly vaginal bleeding that is regular, highly predictable, and reliably persistent in quantity and quality. Let me talk for 1 minute about a regular menstrual cycle. A regular menstrual cycle does not necessarily mean that the vaginal bleeding will be occurring at the same time each month. What it means is that the duration of the cycle is very reliable with a narrow margin of variance. So what we mean in the medical world when we use the term menstrual cycle is counting how many days pass from the first day of your vaginal bleeding until the next first day of the next vaginal bleeding. And for example, if your menstrual cycle is very reliably lasting 27 to 30 days, so from one period to another period, there are 27 days, that is a good thing. However, if your cycles get shorter and shorter, and from the first day of your monthly period until the next day of your next monthly period, your cycle lasts under 25 days, that indicates a hormonal imbalance, especially if you have 21 to 22 day cycles. It means your luteal phase, which is what happens after ovulation, the 2 weeks post-ovulation, it means this phase is too short. That means you don't have enough progesterone. It might also mean that you have a very short follicular phase, which is dominated by estrogen. And that means that the quality of your egg was not good, and it drove a poor and insufficient amount of estrogen, shortening the follicular phase to ovulation. So again, if you have a weak egg, then the luteal phase will also be weaker, so your cycle will end up being much shorter. There are a lot of nuances that can be interpreted easily and simply by talking to a patient and getting a good menstrual history. Now, please correct me if I'm wrong, but I believe that many of us doctors are so overworked and out of time, we likely don't get all the details of how you exactly get your monthly period. And a lot of the times that means we will miss out on a very important piece of the puzzle that would help us understand how to address your situation. So as a patient that's educated, you should be prepared to provide your doctor with a very clear and concise information about your period. So try not to get bogged down into the details. These 3 key elements are very important to get to your doctor to provide a good history. Number 1, the duration of your menstrual cycle, which is the number of days that pass between the first day of your period and the first day of your next period. Number 2, the quantity and quality of your menstrual blood flow. We need to know how many days your period lasts. Is it normal, heavy, or it's becoming very light? And number 3, do you have painful periods? And do you have painful sex? Or do you have both? These 3 key elements will help your doctor have a very quick grasp and understanding on what's going on with you. So please be sure to prepare them in your mind and have them written down on a piece of paper so the doctor can get the maximum amount of information from you in the shortest amount of time, allowing your doctor to make a good decision for you. Trust me, I hear this a lot. I got this period and it was so strange because my uncle had a stressful fight with my aunt and I listened to it. And don't get bogged down to the details. We do not need the specific details regarding a specific period or specific events that happened around one period. Your menstrual cycle is subject to many complicated hormonal and non-hormonal processes that occur at the right time and in the right way. So if once in a blue moon, you have a huge amount of stress or something happens that throws your body off track, yes, you will have a very weird period. However, one weird period probably is not a cause for concern, but many weird periods will make a pattern, and a pattern indicates a problem. And that's what you need to focus on when you go to see the doctor. Focus on the pattern of your period so you're able to explain to your doctor clearly how this new pattern is now and how is it different than your normal, usual menstrual cycle pattern and how long you've had this pattern. Help the doctor help you. I'm approaching the end of the podcast topic here, so I hope this was informational for you. In my next episode, I'm going to talk about whether or not a woman in menopause that is using hormone replacement therapy should have a monthly cycle or avoid it altogether. But one of the things I like to establish before I end this episode here is touching bases on this whole menopause thing. Once your hormones are declining or have gone forever, it's impossible to bring them back naturally. Your body is born with a certain amount of ovarian reserve. Once your ovary runs out of eggs, it will no longer release any eggs. It will no longer be able to produce natural estrogen and progesterone, but maybe in a few rare circumstances, it could continue to produce testosterone. Using hormone replacement therapy with estrogen, progesterone, testosterone, all 3, but using progesterone in a cyclic fashion, where we only take progesterone 10, 15, or 20 days a month, even if it brings back your monthly flow, it will not bring back your ability to conceive a child. Once your hormones are gone naturally, and we've exhausted that natural egg reserve, and once, as a woman, you have been diagnosed with menopause, you will no longer have the ability to become pregnant naturally on your own. I am mentioning this because many women who choose to get treated at menopause with cyclic progesterone and have a monthly flow, they get a little confused, especially when it comes to their ability to become pregnant. They are certainly done with that part of their life and feeling youthful and rejuvenated with the hormones. They now want to have this absolute assurance there's no chance they can bear a child at this age. Their partners also get concerned. Wait a minute, are you getting your period again? So can you get pregnant again? They want that reassurance as well. So please rest easy and know that if you are in menopause and you are using a form of hormone replacement therapy that creates a monthly period, there is no chance that you could naturally get pregnant. Now, there are some very interesting circumstances for women who are prematurely in menopause. For someone who has premature menopause at age 38 or 39, we fixed their hormones. And now, because we fixed the hormones with hormone replacement therapy, their ovarian reserve, for some reason, gets better and the ovary starts making some eggs. Again, that is rare. So please discuss your specific circumstances, your age, your hormone tests, and whether or not you have any ovarian reserve at all with your doctor. Join me next week when I discuss whether bringing back your periods after menopause is a good thing or a bad thing. I will end here and thank you for your patience and your interest in listening to my podcast, and thank you for your time. Until we meet again, I say goodbye. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.